listening by phone, or if you would like to listen by phone, you can submit your question by dialing the telephone number on the screen. Press 0 on your phone keypad at any time to be added to the queue. We're going to try to answer as many questions as possible. Again, it's an informational, educational town hall tonight for the state. So if you're watching via social media, we are everywhere out there. We invite you to post your questions in the comments box. We have people looking for the comments and looking for the questions to then pass on. Tonight, let's meet our panelists. I am joined by Secretary Mandy Cohen of North Carolina's Department of Health and Human Services. Secretary Cohen has been leading the state's efforts to fight COVID-19 since the beginning of the pandemic. She is a very recognizable face now across our state after the past 20 months. Her team at NCDHHS oversees the public health response to the COVID-19 pandemic. We also have with us Dr. Rashida Monroe. Dr. Monroe currently serves as the Medical Director of Primary Care Pediatrics at Wake Med. She is also the Raleigh Area Campus Director of the UNC School of Medicine and the Director to the Keenan Urban Scholars Program at the UNC School of Medicine. Dr. Monroe leads COVID-19 vaccine efforts with the Sister Circle and her health equity team of volunteers from Wake Med. This group of 6 African-American doctors have vaccinated more than 14,000 people from communities where people have been most impacted by the COVID-19 pandemic. So we really want to thank you both of you women, for being here so much. We do want to turn it over to you both to share some remarks of your own. And so Secretary Cohen, we'll start with you. Where do you want to begin?
Great. Well, good evening, Molly. First, thank you so much for moderating tonight. And Dr. Monroe, such an honor to share the fireside chat with you tonight. So hi again, I'm Dr. Mandy Cohen. I'm the Secretary of the North Carolina Department of Health and Human Services, and I also am a mom of 2 daughters who are ages 7 and 9. So this is a really important conversation to be having. And I'm really grateful for all of you joining to have this talk on COVID-19 vaccines for our younger children. So we've made great progress in vaccinating North Carolinians since the start of this year. More than 72% of adults 18 or older in the state have received at least 1 dose of a COVID-19 vaccine. And now we want everyone 5 and older to get their COVID-19 vaccine. You know, as Molly said, kids can and do unfortunately get COVID. During the most recent surge of COVID over the summer, where we saw a really contagious version of COVID-19, we saw kids get sick pretty often here in North Carolina. Actually, the number of cases rose by almost 200% here in North Carolina and about 240% across the United States. So we know that we need to continue to protect our children from COVID. We know not only can they get sick, unfortunately, they can also be hospitalized. And sadly, we have lost a few children here in North Carolina to COVID. Now, we know kids do get less sick and less severely sick from COVID, but it still can happen. And importantly, kids can get what's called long COVID, meaning ongoing symptoms of COVID, or something called an inflammatory disease that can happen after you get COVID. So again, vaccines are such an important piece of protection that we can use to protect our kids against COVID-19. As a parent myself, that's why I'm really excited for us to have this conversation tonight. And I do want to share right up front that I vaccinated my daughters, again, who are 7 and 9, this past Saturday. But we want to make sure to answer your questions tonight. It's definitely natural to have questions. We all love our kids. We want them to be safe. We want them to be healthy. And that's why I'm excited to be joined by a pediatrician tonight. That is Dr. Rashida Monroe, who's been such a phenomenal leader throughout our response to COVID. And we're going to answer all your questions tonight. So Molly, back to you.
I'm glad you said, Mandy, that it is normal to have questions, because a lot of parents do across the state. And in the newsroom, we hear that all the time. I am going to turn it over now to you, Dr. Monroe, to introduce yourself.
Thank you so much, Molly and Secretary Cohen. I'm really excited to be here tonight with the both of you and to answer questions that parents have. As you said, Molly, I am a pediatrician. I'm also a mom, and I am a mom of an 11-year-old who participated in the Pfizer study, the COVID-19 vaccine studied through Pfizer. So he also has an older brother who's 14 who received his vaccine this summer. But we have treated, families and children who have been impacted by COVID disease. And we are really excited as pediatricians to get in the game. I've been helping to vaccinate adults, as you mentioned, over 14,000 doses that we've given with our health equity team over the course of the past many months. But we're really excited to finally be able to be offering this to children.
Let me go over again. So everybody watching, we're getting more and more people to come in right now. But if you are listening or watching through the phone, you can submit questions. So just use the telephone number on your screen. Or if you're watching on social media, post your question on social media. Press 0 on the phone. If you're on the phone, that's the key. Press 0 on the phone keypad at any time to be added to the queue for your question. So let's get started. I'm going to ask you both a couple questions, and then we're going to take live questions from people calling in and people posting on social media. So we'll start, Secretary Cohen, with you. Some of the basics here. I feel like a lot of us have different levels of understanding of the COVID vaccine for children ages 5 to 11. Give us the basic about the recent announcement that now it is approved and COVID-19 Pfizer vaccine is available for kids that age.
Sure. So really important to know that this vaccine that was just recently authorized just last week by the FDA and recommended now by the CDC went through a rigorous clinical trial. As you heard from Dr. Monroe, her son even participated that trial. Some parts of it went on right here in North Carolina. And it is wonderful news that we now have seen this vaccine be tested in our kids. Important to know that the vaccine is a smaller dose of the adult vaccine. So adults can get a Pfizer vaccine, but our 5 to 11-year-olds are going to get about a third of that dose. It is still a 2-dose regimen. So my daughters, for example, got their vaccine this past weekend, and in 3 weeks, they will get their next dose. And again, we had clinical trials, and importantly, the most important takeaway from tonight is that we saw in those clinical trials, there were no safety concerns or serious side effects noted in those clinical trials. We know the FDA looked at that data really closely, as did the CDC. And as I said last week, they recommended that now our 5 to 11-year-olds receive their vaccine. The great news, unlike earlier in the year with adult vaccines, we have plenty of supply for our kids across the state. And remember that COVID-19 vaccines are free to everyone. And again, as a parent, huge relief knowing that we have this vaccine to keep folks healthy.
Well, Secretary Cohen, let me stick with you on this. Why should parents get their children vaccinated against COVID-19? But also, what do you say to people who have concerns about vaccinating their children?
Sure. Look, I think we all need to remember that while we've been hearing that COVID does impact kids less, I have to tell you, it really does impact our kids. And Dr. Monroe even mentioned in her opening how she's been treating children who have had COVID. We've seen them get pretty sick, get into the hospital, and like I said, unfortunately die, and see some of these long-term effects of COVID. So kids are vulnerable just like everyone else. And I don't want to see any of our kids get sick and have some of those long-term symptoms. And so now that we have this safe and effective vaccine, that is why I want parents to go out and get their kids vaccinated. And like I said, this isn't just talk. I vaccinated my kids just a few days ago, really early on, because I think it's that important. These vaccines, again, went through a rigorous process. And we know that vaccines can get our kids back to the things they've been missing, some of those indoor activities in people and places that they've been missing out on. And so, we just want to make sure that folks can hear from us directly about the science and the data of what COVID does to children, how this vaccine is safe, and how it can protect them.
Dr. Monroe, you said you've been giving the vaccine to kids at WakeMed. What should they expect, a parent, if you're taking your child? What should you expect when you're going to take your child to get the vaccine?
So parents should expect some similar side effects that we've seen in adults and in the older children. a sore arm or low-grade fever, feeling tired, having a headache. That may happen in about 1 to 2 out of 4 people. So less than half of people may feel those types of symptoms. The injection itself is usually in the arm. They can select to have it in the leg. I know most children are used to having their vaccines in their leg. And so if that's what they choose, they can choose to do that if that makes people feel more comfortable. But there have been no significant safety concerns about the Pfizer vaccine, the lower dose in the 5 to 11 group. In the study, we did not see any of the myocarditis risk. I know that's something that people ask me about and sometimes have concerns about. So I think the biggest thing they should expect is to feel relief that they are one step closer to having their child protected and getting back to what feels something like normal for us.
So Dr. Monroe, what do you say to parents who feel like their children have made it this far and they didn't have the COVID vaccine yet and they haven't gotten COVID? And then on the other side, what do you say to parents if a child has already had COVID-19, like my kids, do they still need to get vaccinated?
We absolutely do recommend that children who either have made it this far or who have already had COVID get vaccinated. We know that the protection from the COVID vaccine is stronger and longer lasting protection than having the infection itself. Children don't live alone. Children live with adults and they go to school with other children and other people who have, illnesses or immunocompromised, things that put them at risk. And so though children have had, they haven't gotten as sick as Secretary Cohen has mentioned. Children have gotten sick. Some children have even died, unfortunately. But we've also seen children who have had some long-term effects, some neurological problems, or even problems with their memory or cognitive issues after having COVID. So the end point isn't just preventing death, but also preventing the long-term consequences of having the COVID infection itself.
Long-term consequences is something that's starting to get more and more talk about that. As a reminder for those of you who have questions who are listening in on this right now, you can submit them by using the telephone number on your screen, posting them on social media, or if you're joining us by phone, press 0 on your phone keypad at any time and you'll get added into the queue. So we are going to begin taking your questions in just a moment. But before we do, just one more question for you, Dr. Cohen. Where can parents take their children to receive the COVID-19 vaccine if at any point they decide, yes, this is what I want to go do?
Yeah, great. Thanks for that question, because we really want to make sure that parents know how to, once they make the decision after hearing all of this information tonight, where can they get vaccinated? So kids can get vaccinated at any location that has this smaller dose of the Pfizer vaccine. This could be your own pediatrician's office or doctor's office, a hospital, a local pharmacy like a CVS, a Walgreens, a Walmart, some grocery stores, and we even have additional pop-up sites across the state. The important place you want to go for information is myspot.nc.gov. As I mentioned, there's over 800 locations in North Carolina that are going to carry this smaller dose of Pfizer for our 5 to 11-year-olds. So there's plenty of vaccine. There are certain places that are doing appointments. Some are doing walk-ins, but we encourage you to go to myspot.nc.gov, call ahead, make sure that they have that the child dose of the Pfizer vaccine before you go, but everyone's going to have a spot to take their shot.
Okay, thank you. myspot.nc.gov, just to reiterate that one, that is on commercials you guys might see across the state right now. So we're going to take our first listener question. This is Nicole from Statesville. Nicole, go ahead. What's your question?
Hi, my question is my daughter is considering taking the vaccine. However, I'm concerned as a parent, just given the long-term possible negative side effects of her future reproductive system. How could you answer that?
Nicole, that is something that we hear a lot in the newsroom. You are not alone in thinking that. Why don't we go ahead and start with you, Dr. Monroe, and then Dr. Cohen, if you want to follow up, if there's anything else you want to say, go that way. But go ahead, Dr. Monroe.
Sure. Thank you, Nicole. Thank you for participating and calling in. And I really appreciate that question. We have heard that question quite a bit. And, unfortunately, I think this is some information, kind of misinformation that's been spread and caused people some concern. The truth of the matter is we have seen no decrease in fertility or issues with reproduction in people who have received the COVID-19 vaccine. Many people who have received the vaccine, even in the adult studies and well beyond, have had normal, healthy pregnancies and fertility. As a matter of fact, we do see in people who have COVID infection an increased rate of miscarriages and issues surrounding that. So that's something to consider. But your reproductive system, your immune system are not connected in a way that would cause any impact at all to fertility or ability to reproduce. And so I think, honestly, that's something that we can safely say is a hoax and has been some misinformation that's really been that's circulated.
Gosh, never going to have a good Zoom call if you don't mess up the mute at least once, right? The hoax is so it's a hoax. Dr. Monroe, you're saying it's a complete and utter hoax, and that's a pretty clear answer. Dr. Cohen, is there anything else you want to add to that?
I think Dr. Monroe said it well, and I want to reiterate, in fact, the CDC went so far to put out an advisory to say we encourage women of childbearing age, and if you are pregnant, to get vaccinated, because COVID can actually be so damaging both to mom and newborn baby. So we actually are very much encouraging folks to get vaccinated, and folks do not need to be concerned about any long-term repercussions to reproduction. As I said, I have 2 daughters, so it's certainly on my mind. I vaccinated both of my daughters, so I feel completely safe in doing that.
Dr. Cohen, thank you. Next up from the listener calls and questions is Eric from Charlotte. Eric, go ahead.
Yes, thank you for this opportunity. I've got a 2-part question. What is all the side effects for our children taking the vaccine? And also, why isn't natural immunity being part of the discussion like other countries are having?
So let's start with the first question, Eric. Those are 2 good questions. And Dr. Cohen, let's start with you on all the side effects. Please give a list for our kids from Eric and Charlotte.
So the most common side effects are usually a sore arm, feeling achy and tired for about 24 hours, maybe a headache. I'll just to share our personal family experience again from this weekend. My daughters didn't mention anything. I didn't ask, but they didn't mention a sore arm. They didn't mention a headache or feeling fatigued. So what I would say is every kid is different. The most important thing you can know is that there were no serious side effects that were reported. It's all of these short-term side effects that do go away within 24, 48 hours. And to address, Eric, your very important second question, which is about natural immunity, meaning you've gotten COVID. As Molly mentioned, her family got COVID. And, having an infection like that does give you some immunity. The issue is it's variable, right? We don't know exactly how your body made its immune response, how it made antibodies to fight off COVID if it would see it again. When we give you a vaccine, it's teaching your body in a very specific and strong way. And it is done through clinical trials and science. So we know how your body is going to make its immune response. And we can also monitor for how long that immune response would last. Every kid can experience COVID differently. Actually, many kids, as we've said, don't get very sick from COVID. So it's we have more to learn to know about whether or not, if they've had COVID, if it gives them lasting immunity, and that's what we want. We don't think vaccine gives you forever immunity either, but what we do know is that it gives you longer term immunity than does just having COVID. And so that's why Dr. Monroe earlier said, she is recommending to all our patients, the CDC is recommending that even if you've had COVID before, you want to be vaccinated.
Dr. Monroe, do you want to add anything to that about the immunity specifically?
No, I think Secretary Cohen really covered all the important aspects there, so I appreciate that.
Okay. Let's go to a Facebook question, and I'm reading it here through my computer, so sorry that my eyes are down. But to both of you, is there any waiting period between kids having COVID and getting vaccinated? So if a child just had COVID last week, do they have to wait to get the vaccine?
Yeah, Molly, that's a great question. Really, people need to be outside of their quarantine isolation period after they've had COVID, and they need to be feeling.
From Charlotte, I hope the immunity questions have made you feel better about that question. I can say just from a personal experience, my daughter at the time was 9 last July. She's now 10, but she was the first one to get COVID in our family. And if you go back to July of 2020, that was when the state was really deciding, do we go to school? Can kids get it? And there was a lot of indecision at that point. And I, even being in news at that time, will say I didn't think it would be so serious for kids. And she was very sick, and we had a 3-day-old in our house. And she is fine now, but that, she transferred it to all of us. And I do wonder about the immunity for her and also my 7-year-old boy. And of course, the baby's sort of a non-issue at this point because he's not eligible for a vaccine. But you do wonder about immunity, and because they had it bad, are they okay now? And to hear you guys say, no, go ahead and get it because the vaccine is sometimes better than natural immunity helps me as a parent, not necessarily as a journalist. So I just wanted to add that perspective to it. We appreciate your responses, but I want to keep going to other people's questions because we are getting a lot of them. And let me remind you that if you guys are listening on the phone, just press 0 on that keypad to get into the queue, or comment on social media through the NCDHHS pages where we're watching this so we can get your comments. And I'm getting them through our people who are monitoring them, and it's a lot of questions. So let's go here. The questions about masks at schools. Okay. Dr. Cohen, this is from Facebook. Are kids who get vaccinated safer to unmask at school?
I think this is a great question. And what I would say is, as we've been fighting COVID-19, we've needed different kinds of protection. What we've seen from the science and the data, vaccines are the best protection. And now finally, yay, they're available for our 5 to 11-year-olds. So that's, what brings me relief as a parent. But what I would say is that we need to make sure a lot of our kids are getting vaccinated. I do think if you get vaccinated and you need, again, remember it's 2 doses and waiting 2 weeks after your second dose to be fully vaccinated. Yes, that is definitely going to mean your child would have extra protection. And then so those other layers of protection, while important, you kind of now have that number 1 layer of protection. So we are using masks in school right now because as we can imagine, most kids at school are not vaccinated, and it's going to take some time for our kids to get vaccinated. I think over the next couple of months, as I said, it's going to take 2 vaccines and then 2 weeks. And so I think that as we head into the new year, that we can think about different kinds of safety protocols. Right now, I would continue to encourage everyone to layer protection. And so I would definitely get vaccinated. Your kids going to definitely be more protected, but I would keep wearing masks at school until we can get more of our kids vaccinated, and again, fully vaccinated into the beginning of next year.